How can we treat and address social, emotional, mental health needs? And we refuse to invite social workers, who are the largest providers of mental health services in this country, at the table.
In this entire country.
The whole country. Largest providers of mental health and behavioral health services are social workers in all spaces, whether it's hospital, substance misuse, whatever it is. We are among the largest providers of behavioral health and mental health services in the country, and yet we are the most underpaid and the least respected. We don't have a crisis. A crisis suggests we can't do anything about it and we're panicked. We have solutions, and that means bringing the kids to the table, bringing their families to the table, bringing organizations like yours to the table, bringing organizations like NASW to the table, and bringing the parents to the table. So we are saying, oh my gosh, everything's on fire. Everything's on fire. There's a school mental health crisis. Our kids need this. Our kids need this. And the social workers is sitting there like, yeah, this is what we trained for. Tag us. This is not unfamiliar to us. And it's not because we are some superhumans. It's because we are trained for this. It's because our systems approach allows us to not only look at this problem, but also looks at where there are solutions and strengths. It means that we are trained to look into your spiritual network and see if you have supports there. It means that we know that there is an importance of the human-animal bond. And if having an animal or supportive friend will be able to help you, then we know that will work. Just as much as we know that therapy is not for everyone. We know that perhaps you need an after-school program where you're going to get to be physically active and mentored, because it's a lack of mentorship in your life. And it's because we know that we need to provide services that are responsive and in your language. It means that when I've had a child that is of certain ethnicity, or a client that is of a certain ethnicity or religious group, that I am not going from a lens that says, well, what do you think? If I know that I have someone who's from a culture, a religious identity, a group that says the male identified individuals in this family need to be in the decision-making room, that with their permission, and in honoring that, I am humble enough to say what will work for you. It means that I know that when we talk about complementary and alternative medicine, that I actually believe that modern medicine is complementary and alternative to the practices we've had for thousands of years. It means that I know that networks and kinship groups, indigenous groups, whether the indigenous groups of this country, the indigenous groups of New Zealand, the indigenous group of Nigeria, that there's a kinship approach to addressing needs. And so it's not a one-on-one. I know that we need to involve the community. And that is what's missing from a Eurocentric, white dominant frame. And we have to work to unlearn, because all of us have been trained in this model. We have to decolonize our training, and we have to submit to the needs of our clients to truly work from a space that honors the dignity and worth of each individual, and operates from a space that honors client self-determination. And that is social work.